Welcome. I'm Terry Tropin, and today I'm discussing the new ICD-10-CM coding guidelines for 2022. These will be effective October 1, 2021, so it's coming up. So let's find out about the changes. First, let me tell you a little about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I'm also an AHIMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-CM, ICD-10-PCS, and external cause coding. These are available on Amazon. If you enjoy this video, be sure to hit the like button and click on my picture at the lower right-hand corner to subscribe to my channel. I do a new video approximately every week, so if you subscribe, you'll be sure to keep up. Here's an overview of what I'll be discussing during this video. Many of the changes are clarifications, but some changes, such as diabetes and encounters for organ donations, change the actual guidelines. So I'm going to talk about changes to general guidelines, infectious diseases, neoplasms, endocrine system, mental conditions, skin and subcutaneous tissue, pregnancy, symptoms and signs, injuries, and Z codes. First, let's start with general guideline changes. The wording in bold in these slides are the words that have been added for 2022. So for the general coding guidelines level of detail in coding, they added the sentence, diagnosis codes to be used and reported at their highest number of characters available, and they added and to the highest level of specificity documented in the medical record. Now this isn't a real change, but it's clarification, emphasis on. So for example, if coding gout, code M1A.312 would be invalid because it doesn't include all the necessary digits, meaning the final digit to indicate with or without tophus, which is a stone. So this by itself is invalid. You gotta have that 7th digit. Here's another clarification about documentation for non-physicians, for other providers, other clinicians. So you see that in this, documentations by clinicians other than patient's provider. So they deleted this, moved it down to here, and added some stuff. Okay, they added laterality and blood alcohol level. So this can be documented by other healthcare professionals, and they clarified what other healthcare professionals mean by adding this sentence. Clinicians other than the patient's providers refer to healthcare professionals permitted based on regulatory or accreditation requirements or internal hospital policies to document in a patient's official medical record. So other clinicians can report body mass index, depth of pressure ulcer stage, coma stage, NIH stroke scale, social determinants of health, laterality, and blood alcohol levels. And this continues with that same guideline. So they added documentation by clinicians other than the patient's provider. They added this, information is typically or may be documented by other clinicians. And also says the associated diagnosis such as overweight, obesity, and acute stroke, pressure ulcer, that was already in there, but they added alcohol-related disorders. Okay, so that was another thing that was added. Remember that one of the things that was added to the list on the previous slide was blood alcohol level. So also added added to this sentence, the BMI coma scale, NIHSS, the stroke scale, blood alcohol level, codes for social determinants of health should only be recorded as secondary diagnoses. So these are always second. And there's a new section added for social determinants of health, which we'll get to later. Now, this is an interesting addition. It's not really new information. We know this. We learned this in our classes. They talk about it. So the general guidelines added this statement confirming the need for the provider and the worker and the coder to work together. And it says, as stated in the introductory section of these official coding guidelines, a joint effort between the healthcare provider and the coder is essential to achieve complete and accurate documentation, code assignment, and reporting of diagnoses and procedures. The importance of consistent, complete documentation in the medical record cannot be overemphasized. Without such documentation, accurate coding cannot be achieved. The entire record should be reviewed to determine the specific reason for the encounter and the conditions treated. So the coder can't do their job if the provider is not documenting the information. It's often very difficult in a busy office or hospital to get that doctor to come and clarify something. So if he or she documents it in the first place, then they don't have this issue. Now let's move on to infection and parasitic diseases. And there's a number of changes to the HIV AIDS guidelines. So selection and sequencing of HIV codes, and they just added, do not use this code if AIDS or HIV disease is listed, is documented. So this is for Z21 asymptomatic. So if it says the patient has AIDS or HIV, you're not going to use this. And this is added to HIV positive, known, etc. So do not use this code if they have AIDS or HIV disease. Another change, a phrase was added to the end of this guideline. If a patient is being seen to determine his or her HIV status, use code Z11.4 and counter for screening for human immunodeficiency virus. Use additional codes for any associated high-risk behavior. They added, if applicable. So this is kind of saying that we're not going to assume that anyone who's getting screening has high-risk behavior, high-risk sexual behavior, but it's if applicable. So that's an interesting change also. Also for HIV, added a guideline for patients with HIV who are being treated with antiretroviral medications. So this is a history of HIV managed by medication. If a patient with documented history of HIV disease, it's not really a history because they still have it, it's just being managed. So that's interesting use of words. Is currently managed on a retroviral medications assigned code B20 human immunodeficiency virus, and then code Z79.899 other long-term current drug therapy in addition. So not specific, and I would imagine within the next couple of years we'll probably get a more specific code for retroviral medications. But at this point, we're using other long-term drug therapy, Z79.899 for this instance. Okay, so let's move on to COVID. Some of those guidelines were released in that special release in the spring, but of course they're not part of your book at this point because the book only comes out in the fall or late summer. So these are now printed in your book. So you see that the guidelines used to say Z20.828 for asymptomatic individuals with actual or suspected exposure to COVID, and this was changed to Z20.822, contact with and suspected exposure to COVID-19. And the same change was made in this sentence for symptomatic individuals with actual or suspected exposure, and the infection has been ruled out or test results are inconclusive or unknown. Again, it says instead of Z20.828, use Z20.822, a more specific disease. Of course, Z20.828 is just other communicable diseases. Z20.822 is COVID, so much more specific. The same change from Z20.828 to Z20.822 was made in the guideline for signs and symptoms without diagnosis of COVID. If a patient with signs and symptoms associated with COVID also has actual or suspected contact with or exposure to, instead of using this one, you use this one. So that's made consistent throughout. So signs and symptoms without definitive diagnosis of COVID, they added this in the list of presenting signs and symptoms. So if they don't have a diagnosis of COVID, you report the signs and symptoms. And this reflects the changes to cough, R05.1, acute cough, R05.5, cough unspecified. Those are new codes, and so that's reflected in the guidelines. So personal history of COVID. This was changed from Z86.19, personal history of other infectious parasitic diseases, to Z86.16, personal history of COVID. So again, this has been made much more specific. The same change from Z86.19 to the more specific Z86.16 was made in this guideline, follow-up visits after COVID infections. So for individuals who previously had COVID without residual symptoms or conditions are going to be seen for follow-up, sign Z09. And that's if they don't have current signs or symptoms. So you have, before I said, again, to be more specific, Z86.19, other infectious parasitic diseases, changed to Z86.16, personal history of COVID, made more specific. And I also added information referring you back to the previous guideline if the follow-up visit has, the individual has symptoms, and then another section. So this is, you see post-COVID symptoms in the slide, in the picture. Okay, so multi-system inflammatory syndrome. We're still in chapter 1. This is a new code. Excuse just a second. So a new section was added to the COVID-19 guidelines. M36.81, multi-system inflammatory syndrome, called MIS, is a new code for 2022. If a patient has MIS and COVID-19 list, use 07.1 first, then M35.81. If a patient has a history of COVID, list M35.81 first, then use 09.9. A patient may have been exposed to COVID but not have any current symptoms or history but develop MIS. In this case, list M35.81 first, then Z20.822. So this is giving you the sequencing for these conditions. Okay, here's another new section. Lots and lots of stuff on COVID. Post-COVID-19 condition. You've been seeing this, I'm sure, in the news, and if you're in a facility, probably seen it in the facility too. The guidelines state that you list first codes for symptom conditions related to the previous COVID-19 infection, and then U09.9, okay, for post-COVID condition. So don't use U09.9 if the patient has an active infection, except if the patient has a condition associated with a previous COVID infection and then gets it again, catches COVID again, a new COVID infection. In this case, do U09.9 for the post-COVID and then U07.1 for a current infection, and then any manifestations of the current infection. So again, sequencing and strict rules on COVID. Okay, so let's move on to the neoplasm section. A new section was added for breast implant associated anaplastic large cell lymphoma. So you can see that this in here, this is the breast implant, and large cell lymphoma developed around the breast implant. So this is saying use code C84.7A, anaplastic large cell lymphoma, ALK negative, breast. Do not assign a complication code from Chapter 19. So the lymphoma is not considered a complication of the breast implant procedure. It's listed as just the neoplasm. So now we can move on to the endocrine system. In this system, changes were made to the guidelines for diabetes. These guidelines, this is a significant change. This has changed how you code for diabetes. So diabetes mellitus and the use of insulin, oral hypoglycemics, and injectable non-insulin drugs. So additional codes should be assigned for from category Z79 to identify the long-term current use of insulin, oral contraception, oral hypoglycemic drugs, or injectable. So if they have, this is the important change. So they have oral medications and insulin, you code both. Z79.4, long-term current use of insulin, and Z79.84, long-term current use of oral hypoglycemic drugs. So let's compare the old ones and the new ones, because this is the change. So if the patient is being treated with insulin and oral medications in 2021, it says list only the insulin. In 2022, it says list, which makes a lot of sense because it's a lot more specific as to what actually is going on. The changes for the other ones, for insulin and injectable, non-insulin anti-diabetic drug, those guidelines haven't changed. Oral hypoglycemic and injectable non-insulin, those guidelines haven't changed. And short-term use of insulin given temporarily, those guidelines haven't changed. So the only one that's changed is the one on top. And these guidelines apply to diabetes and also secondary diabetes. So this is a significant change. Changes were also made to the chapter on mental conditions. The changes discuss the use of substance use, abuse, and dependence related to a medical condition. The guidelines state that the medical condition and the psychoactive drug use, abuse, dependence are both coded. So this new guideline, medical conditions due to substance use and dependence are not classified as substance-induced disorders. So it's not the medical condition is related to the substance use, but it's not induced by the substance, psychoactive substance. Assign the diagnosis code for the medical conditions directed by the alphabetic index, along with the appropriate psychoactive substance use, abuse, or dependence code. So what does this mean? Well, it gives an example. So you have alcoholic pancreatitis due to alcohol dependence. So this is the pancreas. So it's saying code for the pancreatitis, alcohol-induced acute pancreatitis, and the code from the mental section, in this case, alcohol dependence. You're not going to code alcohol-induced disorder, F10.288. So you're going to code for the pancreatitis, K85.2, and the substance use, F10.2. Okay, another change was made to Chapter 12, Skin and Subcutaneous Tissue. The guidelines for unstageable pressure ulcers have been clarified. I don't know if this is, it's kind of sort of a change. So they talk about unstageable pressure ulcers, and this of course is an ulcer that is covered by eschar or been treated with a graft, something like that. So guideline, the addition says, if during an encounter the stage of an unstageable pressure ulcer is revealed after debridement, assign only the code for the stage revealed. So if there's a graft, or if there's scabbing over the pressure ulcer and it's debrided, and after the debridement they can tell that it's stage 2, stage 3, whatever, you will report the stage 3, you'll no longer use the unspecified. So it could change from an original code for unspecified, from unstageable, and then in the next encounter after debridement have a specific stage. Okay, changes were also made in the pregnancy, childbirth, and puerperium chapter. For example, subcategory 024.11 includes codes for first trimester, second trimester, and third trimester, but not in childbirth. So what the guideline is saying, when the classification does not provide an obstetric code with an in-childbirth option and the patient was delivered, it's appropriate to assign a code describing the current trimester. So if the code is 024.11, the patient delivers in 30 weeks, there's no in-childbirth option, so use a code for third trimester, 024.013. So if there's no in-childbirth option and they deliver, just use the code for the digit for the appropriate trimester. It really doesn't affect coding, but it's interesting that some codes within the pregnancy chapter change the wording from woman or mother to patient. This changes were made in gestational diabetes, alcohol, tobacco, and drug use during pregnancy, childbirth, and puerperium, diabetes, normal delivery, and pregnancy. So these change the wording from woman or mother to patient. Now, obviously, the patient is a woman. They may or may not be a mother, and they're not a mother for this baby until the baby is born, but it's interesting that they made that change. However, they did not make that change in some other sections within the pregnancy, childbirth, and puerperium section. They did not change the wording from woman or mother to patient for pre-existing conditions versus conditions due to pregnancy, fetal conditions affecting the management of the mother, and admission for routine postpartum care following delivery outside the hospital. So sometimes they changed it and sometimes they didn't. Okay, so changes were also made to the coma guidelines in the symptoms and signs chapters. First, in the guidelines, the word scale was deleted, so it just says coma. The real issue here is that last year, the wording, the coma scale codes can be used in conjunction with traumatic brain injury codes was added. It was not clear whether this meant that coma codes could only be used with traumatic brain injuries. The guidelines didn't say don't use them for other issues. It didn't say you could use them for other issues. It just didn't. So this year they added a sentence, code R40.20, unspecified coma may be assigned in conjunction with codes for any medical condition. Now, it's still saying that R40.21, R40.24 are used in conjunction with traumatic brain injuries. So it's still kind of unclear. It also says, this is interesting, if multiple coma scores are captured within the first 24 hours after hospital admission, assign only the code from the score for the time of admission. So between that period of time of admission and 24 hours, you'd use one code, the one for admission. Okay, they may take additional coma scale readings, but these are not documented. These are not part of the official documentation. Okay, Chapter 17 includes codes for injuries. It clarifies that category T31 and T32 are used for acute burns or corrosions. You can see this area here. It says that codes from category T31 and T32 should not be used for sequelae of burns or corrosions. These would be documented using, of course, the other injury codes. T31 and T32 do not have a 7th digit for sequelae. Okay, Z codes. These are Chapter 21. The title of Guideline B under Chapter 21, they had this addition. Z codes indicate a reason for an encounter or provide additional information about a patient encounter. So that's a change. And then under history, it says the reason for the encounter screening or counseling should be sequenced first, and the appropriate personal or family history code should be assigned as additional codes. So the history codes Z80 to Z87 are second in this instance. The guidelines for observation were also revised. The phrase beginning with e.g. patient presents for treatment following injuries sustained in a motor vehicle accident is also observed for suspected COVID-19 infection that is subsequently ruled out was deleted, and this is covered in the COVID-19 guidelines. So it was deleted from the observation care. Another small but important change was made to guidelines for patients seen for organ donation. The current guidelines state these codes are for individuals donating to others, but not for self-donation. So they added 2 words and deleted 1 and completely changed the meaning of this. The new guidelines state these codes are for individuals donating to others as well as for self-donation. So this is the opposite. The guidelines for counseling were also revised. A note refers to the new code Z71.85, Encounter for Immunization Safety Counseling. We can all figure out why this was added. The guideline says code 71.85, Encounter for Immunization Safety Counseling, is to be used for counseling of the patient or caregiver regarding the safety of a vaccine. This code should not be used for the provision of general information regarding risk and potential side effects during routine encounters for the administration of vaccines. So Z71.85 would be for patients who are vaccine hesitant, not just routine coming in for a shot. A new section was added in the Z codes chapter for social determinants of health. So the underlying section, this here, was moved from the general guidelines to this section. Again, this section also confirms that social determinants of health codes are can be documented by clinicians other than the provider. And here is a list of the social determinants. Z codes, education and literacy, which is the codes have been expanded for 2022, and housing has been, Z59 has also been expanded for 2022. That completes this video. If you have questions or comments, please feel free to contact me. For a discussion of the new codes, see ICD-10-CM 2022 Changes Part 1. If you enjoyed this video, please give it a like and or subscribe at by clicking on the picture at the lower right-hand corner. Again, here are the books I've written on coding. They're available on Amazon. The easiest way to find them is to go to Amazon Books and type in my last name, Tropin, or click on the link in the introduction to this video. Thank you so much for listening. I hope to have more lessons up soon.